Welcome to our podcast. Today we're diving into the nitty-gritty of levofloxacin, its uses, important warnings, and all the special precautions that come with it.
I'm excited to get into it. There's a lot to unpack. What's the first thing we should know about levofloxacin?
Well, for starters, levofloxacin is a fluoroquinolone antibiotic primarily prescribed for infections like pneumonia, various kidney, prostate, and skin infections.
Yeah, indeed.
It's even used for more unusual cases like preventing anthrax and treating plague.
That's interesting. It's not your everyday antibiotic. So, it's kind of a heavy hitter in the treatment arsenal, right?
Absolutely. But here's where the serious side of things kick in. The manufacturer and Medline Plus offer an important warning. Taking levofloxacin increases the risk of tendinitis and even tendon rupture.
Oh, wow. Tendon rupture? That's pretty severe. How common is that?
The risk can affect any tendon, like those in the shoulder, hand, or ankle. It's particularly concerning for individuals over 60 or those who are very physically active. It's kind of like asking an old bridge to hold up a heavy load. It's just not built for it.
Right. And I recall that there's also a caution for people who have had transplants or even conditions such as rheumatoid arthritis. Is that correct?
Exactly. Patients with a history of kidney, heart, or lung transplants, or those with joint and tendon disorders need to be extra careful. And if you're on steroids like dexamethasone or prednisone, the risk increases even more.
Mm-hmm. That sounds like a double whammy. Both the antibiotic and other medications can compound the risk, right?
Yep, that's right. And if you ever experience symptoms like pain, swelling, tenderness, or stiffness in your tendons, you should stop using the medication immediately and call your doctor. It's like a built-in safety trigger.
I mean, that's a critical point. But aside from the tendon issues, there are other serious side effects mentioned, yes?
Definitely. Levofloxacin can also cause changes in sensation and even peripheral nerve damage. Imagine suddenly feeling numbness, tingling, or even burning in your arms or legs. That's not something to take lightly.
Right. And these nerve problems can persist even after stopping the drug, which is really concerning.
Exactly. And then there's another slate of warnings regarding the effects on the brain and nervous system. This can include dizziness, tremors, headaches, and even more alarming symptoms like hallucinations or severe mood changes. It's like the medication can affect both body and mind.
It almost sounds like you're stepping into a minefield. Considering the severity, is levofloxacin prescribed lightly, or is it usually for really tough infections?
Typically, it's reserved for those serious infections where other antibiotics might not cut it. For example, when you're battling pneumonia that doesn't respond to typical treatments, or in cases of complicated infections like endocarditis or certain STDs.
Yeah, I get it. So, it's a bit like a double-edged sword. A very effective treatment, but with serious risks if not monitored carefully.
Exactly. And what's even more interesting is how the usage instructions are so detailed. The medication should be taken exactly as prescribed, once a day for the most part. Whether it's the tablet form or the solution, there are specific instructions, like taking the liquid 1 hour before or 2 hours after eating.
That precision reminds me of managing a delicate instrument. One wrong move, and the whole thing can go off track, right?
Absolutely. And the instructions also stress the importance of not skipping doses or stopping early just because you feel better. It's like leaving the engine running when you're halfway through a ride, which might lead to incomplete treatment and antibiotic resistance.
Yep, that's crucial. And I imagine that if you miss a dose, there's a clear guideline too?
Yep, you take the missed dose as soon as you remember. Unless it's almost time for the next one, then just skip it. Don't double up because that can lead to further complications.
What about interactions with other medications? It seems like a lot of things need to be considered here.
You're spot on. There's a host of potential interactions. For instance, if you're using antacids containing aluminum or magnesium, or supplements with iron or zinc, you need to space them out from your levofloxacin dose by at least 2 hours.
That's a good tip. And there are also interactions with NSAIDs like ibuprofen, right?
Yes, indeed. Plus, if you have heart rhythm issues, like a prolonged QT interval, or if you've had heart issues, low potassium, or even conditions like diabetes, your doctor needs to be fully aware before prescribing
I see.
levofloxacin.
It seems like such a comprehensive checklist, both for the patient and the doctor.
Exactly. And then there's an entire section on special precautions regarding sunlight. Levofloxacin can make your skin sensitive to UV light, so it's advised to avoid prolonged sun exposure and wear protective clothing just in case.
Yeah, that's like having an extra layer of caution on sunbathing, and I bet there's also important advice on storage and disposal.
Absolutely. You're supposed to keep it tightly closed in its original container, store at room temperature, and keep it away from children. There's even a reminder not to flush it or leave it accessible. Think of it as keeping dangerous tools locked up.
And if someone accidentally overdoses?
In the event of an overdose, you're to call the poison control helpline immediately, or 911 if the situation escalates. The guidelines are pretty clear on that.
Right, that's essential information. So after all this, it almost feels like getting a prescription for levofloxacin is not just about tackling an infection. It's also about undertaking a responsibility for meticulous management and self-monitoring.
Yes, exactly. And while levofloxacin can be life-saving in critical situations, its risks require that patients follow every directive to the letter. I do wonder, though, sometimes the warnings can seem a bit overwhelming.
Mm-hmm. But don't you think that level of detail is necessary, given the potential for severe side effects?
I get your point, but I feel like sometimes patients might be so overwhelmed they could end up either avoiding useful medication or mismanaging their schedule. It's a delicate balance.
True, true. It really calls for very clear patient-doctor communication. Exactly. And it shows why patient education is crucial. The more you understand these risks and instructions, the better you can weigh them against the benefits.
Right, and let's not forget that the official Medline Plus page, besides detailing all these warnings, also offers links to reliable sources like the FDA and even poison control information. This ensures that patients can verify and get more details whenever needed.
Absolutely, that's really helpful. In wrapping up, it sounds like levofloxacin is a potent tool, beneficial in fighting serious infections, but not without its hazards, which require vigilant, informed usage.
Exactly. It's all about leverage, effective treatment on one hand, and strict adherence to precautions on the other, ensuring your safety. Thanks for this enlightening conversation.
My pleasure. It's been a thorough look at how important it is to understand your medications. Thanks for joining me on this discussion.